everybody hear me? Okay. So it's really an honor and a pleasure to be here. Thank you so much for the invitation and the opportunity. Okay, so I'm going to talk today about being patient-centered or person-centered about things that matter. And I have nothing to disclose except for my passion for this topic. And I hope that it's contagious. So as you heard about my bio, I'm the medical director of the Montefiore-Hudson Valley Collaborative, which is one of the other PPSs in New York State. I'm also an associate professor. I'm a member of MINT. So I have a lot of credentials, but the most important one is I'm a primary care doctor. And so I really have a lot of experience at the front lines of care, and I understand how difficult it is to engage patients and address all of their needs, and how that could have an impact on their health and quality overall. So as a primary care doctor, I have a tendency to revert to the word patients, because that's the people I work with. But I recognize that there are many other terms that might describe the people that you're working with, right? Does this capture? Or just the people that we work with. So as I go through my talk, please substitute the terminology that you use that is close to you, all right? Because it's relevant across all kinds of provider types, from primary care to behavioral health to substance abuse to community-based organizations. So just make that substitution in your head. Does that work for everybody? Great. Okay, so I wanted to get an idea of who's in the room. So healthcare providers, just raise your hand. Okay. Doctors, nurses, okay, social workers, behavioral health providers, substance use providers, okay. Who did I miss here? Community health workers, okay, peers, family members, patients. I guess we're all patients, right? Administrators, local government units, Department of Health, okay. Managed care organizations. Who am I missing? CBOs. Right. Oh my God, I missed it on the slide. I haven't forgotten you, trust me. So CBOs? Yes, okay. Anybody else? Yes? Union, okay. All right. And any change agents in the room? Come on, aren't we all change agents? Okay. All right, so my agenda today, I'm going to introduce you to what matters to you. I'm going to share some of our MHVC, Montefiore-Hudson Valley Collaborative, stories of impact that the campaign has had on our population and our quality. You'll have an opportunity to experience it independently. So we'll do an experiential activity. We'll discuss how what matters to you can impact quality outcomes, patient experience, and joy in work, really important. And then I'll share with you some what matters to you resources so that if you're engaged and excited about this, you'll be able to take it back to your own organizations. Does that sound like a good plan? All right. Okay, so I'm going to talk about being person-centered around things that matter. And as a healthcare provider, I'm very committed to improving the quality of care that we deliver for our patients. And recognize that you really need to be very effective at engaging patients to improve the quality of care. And what I've learned through my experience is that communication skills training of providers and nurses and staff is so integral to actually having an impact. I'm going to talk a little bit today about how the right person on the care team, and this could be an extended care team, this could be past the medical provider, past the behavioral health provider. I'm talking about the community-based providers, the community-based organizations, anybody that touches that patient, asking the right question at the right time, can have an impact not only on quality measures, but also on patient experience. And how does this relate to VBP, right? Well, we know that VBP is about improving quality, improving patient experience, because that will lead to pay for performance. And so that's how it connects, right? So this is Maureen Bisognano, and she is the former president of the Institute of Healthcare Improvement, and she's really an amazing woman. And about 6 years ago, I had the opportunity to attend the AHI meeting for the first time, and I highly recommend that meeting if you've never been there. And she was in front of an audience of about 5,000 people, and she challenged this audience of healthcare providers from across the world, senior level executives and frontline providers, to shift healthcare from what's the matter to what matters to you. And we'll talk about this, all right? So here's an example. This is a patient, in the middle here. And he's a great gentleman. He has a great personality, and he has heart failure. And he ends up admitted to the hospital on Saturdays. It's always on a Saturday afternoon, evening, almost every time. And it's happening like about once a month, maybe twice a month sometimes, so it's quite frequent. And when they asked this gentleman, what matters to you, you know what he said? Having lunch with my Romeo group. Retired old men eating out. And guess what they like to eat? High salt meal. They love to get a steak. They go out on Friday afternoons, have a steak or a hamburger and the French fries and the salt and the ketchup and all those things he probably shouldn't be eating. And then what would happen is he would retain fluid, and by Saturday afternoon he was short of breath and he'd end up in the hospital. So now, you know, as a healthcare provider, you have a patient with heart failure, what do you usually do? You tell them to stay away from the salt. But what really matters to him is having this meal with his buddies. And is he going to not have that meal with his buddies when that's the most important thing to him? Probably not. And so there's where the opportunity is, because maybe we need to shift our care plan a bit around what's important to that person, right? So for this gentleman, if it's having food with his buddies and he's going to have that hamburger no matter what, maybe the healthcare provider would say, you know, I know you're going to have that hamburger, although it's probably not the best thing for you to do, but if you're going to have the hamburger, take an extra dose of the Lasix. And so by shifting our planning and shifting our, you know, our care plan and being willing to really meet the patients where they're at, rather than what we think they should be doing, we might be able to be more effective in our care. In fact, we will be more effective in our care. It's about partnering with the patients. Here's another example, and this is a true story. I changed the name, but it's a story that's very near and dear to my heart because this was my patient. And I worked at Bellevue Hospital for 18 years. This is a woman who had a lot of stressors in her life, and I examined her and I found that she had a very large mass in her breast. And I sent her for mammogram. It was a cancer, and she probably had it all over her body by the time that we identified it. And she refused to go for treatment. The reason she refused to go for surgery or chemo is because she was concerned that she was going to be evicted. And she said to me, Dr. Gutnick, I know, but if I'm in the hospital and something happens and I have to stay overnight for more than I might come back and I might not be able to get into my home and maybe, you know, evicted. So she was very, very reluctant. And this was so hard for me. I referred her to a social worker. I tried to do what I could, but I didn't have the tools to address what she needed. And I didn't really understand what she was telling me about her housing issues and how I could help her. But I was trying. And it was very, very frustrating because, you know, 2 years I tried to get this woman into treatment. 2 years I would call her every other week. You know, I'm really concerned. Can you please come back? Can we try to? Nope, always concerned about her housing. So when you ask what matters to you, you're going to learn a lot about your patients. And oftentimes they're not related to the medical condition, the things that you do in healthcare usually. It's oftentimes these social determinants of health. And a lot of healthcare providers are really afraid to ask that question because it's like opening a Pandora's box. What am I going to do when I discover, you know, things that I don't know what to do with or how I can help? And so it's a little scary. But what's cool right now is because of DSRIP, well, and also I wanted to say that the social determinants of health, we know that they're extremely expensive. And when we put the Band-Aids on these things, you know, and kind of address the short term rather than the underlying drivers of the social determinants, it's not going to help. It's just a Band-Aid. So DSRIP provides this really unique alignment opportunity because now we have in the room the community-based organizations who have that expertise to address the housing. And we have that expertise to address the food insecurity. And those partnerships are so valuable, and having the frontline providers understand that there's organizations that can help them, that they don't have to do it all in the doctor's office. And how do we make those partnerships really tight and effective, and the linkage go back and forth so that we're holding each other accountable? And because for me, the hardest thing as a healthcare provider was you refer somebody there somewhere and you don't know what happens, and the patient still comes back with the problem. So you don't know if you've been effective. But if you're able to close the loop on those referrals and have coordination and collaboration between a community-based organization and the frontline staff in a doctor's office, wow, that's where the money is. That's where the opportunities are. So asking what matters to you, the issue is that healthcare providers will probably figure it out. You know, you're going to sit there and talk to the patient, and all these stressors are eventually going to come out in the visit. But what I like about what matters to you is it gets to the heart of the matter much more quickly. And the number one thing that healthcare providers always complain about, what is it? Time, right? We don't have time. So anything that's going to add efficiency to my visit and get me targeted where I need to be up front is a real win-win. Okay. So what matters to you has become a global unit, a global campaign. It first started in Norway and Scotland. And I'm going to share some of the examples from Scotland because that's where I first heard these examples, and that's what got me bought into this. But it's spread all around the world. And the Montefiore Hudson Valley Collaborative has really been a pioneer in spreading it throughout the United States. And we've been working very closely with the AHI and Maureen Bisognano, and you'll hear some stories of our implementation across a wide variety of provider types. So an example from Scotland. And I'm going there this Friday, next week, to the IHI meeting. It's in Scotland again. So implementing what matters to you on 2 geriatrics wards. There was a really great nurse manager. Her name's Geraldine Marsh. And she said, I'm going to implement this in a geriatrics ward. And she went to her nurses with the idea. And the nurses said, another thing to do, no, no, no. And she talked them into it, and she just made it happen. She said, no, we're doing this. So a lot of reluctance up front from the frontline staff. This is what she did. Every patient, when they came into that geriatrics ward, filled out a what matters to you daisy diagram with what's important to you in the middle. And they could write anything that was important to them around the sides. And then this got hung up over the bedside. And this is an example. This is Barbara. Barbara was a patient, older woman who had a hip fracture, and she was not really engaged in her care. They'd come around and to take her to rehab and to physical therapy, and she'd say, not today, I'm in pain, not today, I'm not getting out of bed. And we all know that the idea is to get you up and moving more quickly, right? So she was just not engaged, and she was quite depressed. So now this is what's over her bed. In Scotland, I lived in Rio de Janeiro for 42 years. I can speak fluent Portuguese. She's like, 80-something years old, 88 years old, I think. I was in the Women's Air Force, and this one, I didn't realize what a big deal this is. I have an MBE. This is like knighthood in England. This is like you get an honor from the Queen because you've done so much community service, and you're like, I forget what it stands for, but it's a big, big deal. I didn't realize that until I met another person with an MBE. So lots of interesting stuff. So this is hanging over Barbara's bed, and everybody comes by and says, Barbara, you had an MBE? Tell me about the stories. You were in the Women's Air Force, and all of a sudden, Barbara's, the life of the party, talking about her life, and engaged by the staff that are coming by all the time, and participating in her physical therapy, and going home because she wants to go home to this interesting life rather than to stay in the hospital. So that's one story. On the same ward was a woman, Rose, and Rose had dementia, so she couldn't fill this out herself. But her family said, well, what's important to Rose? And a little bit more about Rose. She would sundown in the evenings, get out of bed, and fall. So the staff felt she was a tremendous fall risk, and they were thinking about restraints. It was a big to-do. So the family members said, well, what's important to Rose is she's quite religious, and she always needs to have her rosary beads with her. If she doesn't have the rosary, she gets agitated. What would happen is Rose would have the rosaries would fall on the ground, the nursing staff or the housekeeping staff would pick it up and put it in the bedside table in the front drawer. And of course, Rose didn't have her rosaries. So now over the bed, it says what's important to Rose is her rosaries. The rosaries on the floor, the nurse picks it up and says, here, Rose, here's your rosaries. Or maybe sometimes they put it around her neck like a necklace. Some staff would even come by and do rosaries with Rose. And as a result, less agitation, and Rose didn't fall anymore. She didn't get out of bed. She didn't sundown as much. So Geraldine Marsh was all about, okay, this is cool stuff, but I need to measure the impact of what I'm doing. So she had different kinds of measures. She had process measures, like did we ask the patient the questions? Did we put out how many boards are completed over the beds? And then she had outcomes measures, like the number of falls on the unit, the number of patient complaints, and patient and staff satisfaction. Look at this, all right? So on the 2 geriatrics wards, 43% reduction in falls. That's big. And patient satisfaction, it was amazing. They had one ward that didn't have, a unit that didn't have any complaints in over a year, 50% reduction in formal complaints. They spread it to 4 units. So 50% reduction across the 4 units. And the staff, remember I told you they were really resistant and they felt they knew their patients, it was another thing to do. They were sold. This allowed me to see my patient in a new light. It has made me more confident dealing with patients with dementia. I was skeptical at first. I thought I knew my patients. I was wrong. It helps build a bond between patient and staff activity, between patients and staff. So what this impact was, it's bringing joy back into the work that they're doing. That's really important. We'll talk more about that in a few minutes. This was also implemented at a pediatric unit by what's her name? Jen Rogers. She's a pediatrician, and she implemented in pediatrics unit very, very successfully. And you can find a lot of information about this online too if you're interested. So I'm going to share our What Matters to You journey at the Montefiore Hudson Valley Collaborative. And in June 2017, we had a meeting similar like this. We did it in 3 different regions in our counties, and we brought people together to talk about VBP, and I did a keynote very similar to this. And that was kind of the start of it. You all got, who didn't get glasses? Everybody got glasses when they came in? Okay, we'll get there. But these are all our senior leaders in our steering committee. And they're wearing What Matters to You glasses, all right? The idea is that these are person-centered frames to think about things from, remind you to think about things from the person's perspective, from the patient's perspective, rather than the perspective of your organization and what you think you should be doing. What do we do for the patients? And here we have all the senior executives from the hospitals, behavioral health, primary care, our steering committee donning these glasses to show their commitment to trying to implement this across their organizations. Very powerful. I'm going to share some examples. So one of the first people to raise their hand in this kind of a session, because we debriefed, was HDSW, Human Development Services of Westchester. They made the commitment right when they heard it. They said, we're going to do this. We're going to make this the foundation of the work that we do. It's going to become our new marketing. And I'm going to share what they've done. So first of all, they took the What Matters to You and they made it their own. It says, what matters to you matters to us. That was their logo. And this is a What Matters to You tree, Matters to Us tree. So they run a living room program for patients in crisis, and they also have a clubhouse program. And they begin their clubhouse program every day, and you'll see a video in a moment, going around and asking each client in the clubhouse what's important to them. And that's how they start the day. And they also fill out forms, and they can put it up on the tree, and it's really part of the thematics of all of the work that they do. It carries through. So I'll share a video now.
Come on in.
They always ask, first thing when I come in, what matters to you? What, as a guest, you would like to work on that day?
The living room is a crisis day respite service to help people to divert from ED and the hospital. People are able to rest. They can use computers here. We even have a shower for people who might need that service. We have a little fitness room. An integrated delivery system of service should be seamless. The one thing that we're trying to work on here is having that integrated information. I have a care manager who's going to help me to coordinate care. My behavioral health provider understands my physician. Everybody knows each other. They are all talking to each other. A community of care should be based around a person.
I know it's helped me to stay out of an inpatient psychiatric hospital. I was having suicidal thoughts, and I think without the support of the living room, I wouldn't have made it through.
Once they realize that we're serious, they kind of settle down and open up and really tell us what matters to them.
When you ask what's the matter, a patient or a person will talk about a chief complaint. My chest hurts, or my toenails turning purple. But if you ask what matters to you, you'll uncover the social determinants of health needs and priorities that the patient is dealing with at that moment.
What matters to me is that people with mental health issues are not stigmatized.
At Hope House, every day, people ask, what matters to you? They made it part of their morning meeting.
Go ahead.
If someone's either getting a job or just getting up and coming into the club to be with people, it's a celebration. And it's having opportunities for people. So whether it's being able to answer a phone or work on the daily newsletter or to have job club, people get together to learn how to write a resume and how to apply for a job. It's having family, it's having friends, it's having meaning in their life.
We've launched this in the Hudson Valley. We brought this to our steering committee at MHVC. There's an image of all of our steering committee executives putting on their What Matters to You glasses and making a commitment to adapt the campaign into their organizations and the care that they deliver.
When we ask what matters to you, we're going to discover a lot about our patients and the people that we work with.
At Human Development Services of Westchester, we've made the commitment to bring this training to all of our colleagues and to our members of our Clubhouse program.
I want to encourage everybody and challenge you to put them on for a moment. How does that feel? Patient-centered frames for the work that you do.
The next step is to convene our partners together to think about common metrics that can be applied across the network to measure joy in work as a result of the campaign, as well as the impact of what matters to you.
It lets me know that the people that I work with care. And if we're having a bad day, they kind of offer us support without sitting down and saying, I'm offering you support. You know what they're doing with their kind words.
I kind of developed my own inner strength so that when I go back into the community, I can handle things well.
Oh, I love it. This is what I should have been doing all my life.
So the campaign, the idea is you ask what matters, but then you listen very closely to what the person says, and finally you do what matters. You don't just ask and leave it, but you actually have to take an action on it. And I'm going to give some examples. So this is Cabrini Nursing Home, a skilled nursing facility, and this is a story that they shared with me. There was a patient who had a hip fracture, and she was in rehab. And what they did was they started to ask the families what's important to you, what matters to you. And this particular woman was quite depressed, and she was not very engaging with any of the staff and kind of very, very quiet. And they asked her husband, what's going on, what matters to her, what matters to you? And he said, well, my wife is in rehab because she broke her hip, and she's quite depressed. She knows she has to be here, but tomorrow is our 55th wedding anniversary. And she's very depressed because for the last 54 years, we've celebrated our wedding anniversary the same way. We've always gone out for a surf and turf dinner, and she knows that this is going to break our tradition. We can't do that tomorrow. And so the nurses heard this, and they all talked about it as a team. And then they talked to everybody else, and they found out that the executive chef at the nursing home used to work at Sheraton. And when he heard this story, he said, I can make them a surf and turf dinner. And he did. And so the woman went for rehab. The husband was in on it. He came in with a little bow tie. He was all dressed up. And they wheeled in, and she came in out of her rehab, and the smile that came to her face, and it was amazing. It was amazing. And it empowered, first of all, I'll show you their patient experience measures. They went up. They were really pretty good, but they went up higher. But the staff just felt so good about doing the right thing and about making a difference. Sometimes when you ask this question, you get to the drivers of the hospitalization in the first place. And so this is another example from the same facility. So, and it's a theme. It came up time and time again. So it identified what were the underlying drivers of grandma's fall in the first place. And what they're discovering, when they ask the family what matters to you, is, well, grandma drinks too much, and we don't know what to do about this. And so in at least one case, they were able to discharge the patient from the rehab directly into an inpatient alcohol program. So it allows you to really get at the underlying drivers. Otherwise, she would fall again and again and again, but it empowered the family to do the right thing and to feel supported, and the staff just felt like they were doing the right thing. My fun graphic. Okay, this is another story. This is Arms Acres. They're an inpatient and outpatient drug treatment program. And they decided to embrace this. And the executive director really held it close, near and dear to her heart, and she's walking on rounds, like she rounds every few days on the floors to see what's going on. And there's an extremely agitated woman who's screaming and really difficult. And she went up to this woman and she said, "What's important to you? What matters to you? What's going on?" And the woman said, "You know, I've been here for 2 days. They took my wig away when I came into this program. They told me I can't have my wig. My wig's really expensive. It took me a long time to raise the money to buy my wig, and it's really important to me. And I need it because when I get out of here, I can't go to work because I don't have nice hair, and I feel good when I wear my wig. Nobody's telling me what's going on with my wig." So the executive director gets on the phone with the staff, and she says, "Where's the wig?" And the staff said to her, "I don't understand. We don't understand why she's so fixated on the stupid wig. She's in an alcohol and drug program because she's using drugs. She should be focusing on her drug treatment, not on the wig." And the executive director said, "Just get her the wig." So they bring the wig. The woman's like, "Oh, okay, my wig's safe." They said, "You can't keep it here. We'll keep it safe for you." "Okay, I feel much better." And guess what? Now she was able to focus on her drug treatment. And that was like an aha moment. Like the staff were like, "Oh, we get it now. We get it. We have to be person-centered." Okay. All right. This is another Sizzle wheel. I'm going to show it. Parts of it overlap a little bit, but there are primary care and hospital people here. Yes? Okay, so I think you'll appreciate it.
Any of us could ask a patient 15, 20 plus questions and still not know what their priorities are.
They usually have the answer to what they need if we only took the time to ask, "What do you need? What do you want now?"
We have to sometimes put aside our own biases and our own projections and kind of meet the patient where they're at.
You have to prioritize what's the most important need that needs to be addressed for that patient right then and there. And by asking what matters to you, you'll uncover that and be able to really target your interventions.
Cornerstone Family Health Care is a federally qualified health center. We provide primary care, specialty care, care management, behavioral health, substance abuse treatment.
The what matters to you is something that really cuts through all of the questions and helps us to pinpoint which social determinant, which piece is the most important right now.
I have a specific patient who has constant issues with transportation, but it's because she depends on her son. So the issue is really not transportation, the issue is her relationship with her son. What is it that you need? Why don't you tell me what you want so that I can help you?
Do you need a dentist?
She was frantic and she kind of relaxed, and it wasn't so much just her transportation, it was just, you know, my son's not gonna help me anymore. So she got her needs met. It actually cut our time in half, how I worked with her, and she was able to say, "Thank you for listening to me," which is something she had never said before.
I have shared the What Matters to You idea with the other nurses, and I asked them spontaneously, I said, "What matters to your patient?" And some of them looked at me and said, "What do you mean?" I said, "Well, why don't we start asking our patients what matters to you?"
I think it was very important, even just to send a message, for me to get up in front of my staff, giving them permission, enabling them, reminding them that this is what we want from them. And the What Matters to You was just a great vehicle for me to send that message.
We're one of the 11 hospitals at Montefiore. In healthcare, how our patients experience their stay with us is really important. There's nothing better than active listening.
Hey, good morning, team. Today I'd like to ask you what matters most to you.
Teamwork. Happy nurses is a happy floor, happy unit, happy patients.
The first step is learning how to ask the question. So like anything new, it's awkward at first. You know, what matters to you? But once you start saying it and start to own it, people can feel the real question come out.
It adds efficiency to the work that we do if we uncover what's important to the patient and are able to design our care plans around that so that patients are more likely to be adherent.
We have a saying here at Wakefield, it's every patient, every encounter, and every single time. So it's really about consistency.
What matters to you today? What do you want to focus on?
When you ask somebody what matters to them, that brings in that more wholesome part of health that sometimes we've missed in the past.
I work in a mother-baby unit. I went to see this particular patient, which was known to the healthcare team as non-compliant. She did not take her medication. She didn't comply with prenatal care. First I said, you know, before I do anything, is there anything that you want to tell me? Is there anything that you want to talk about?
She chose to ask the question, like, what matters? What could I do to help you right now?
There's something that I can get for you. She said cookies and orange juice. I said, okay, I'll be right back.
All she really needed was cookies and a little bit of juice. Really helped her, you know, kind of settle in and get the test done.
I thanked her for allowing me to do the test, and she said, thank you for listening to me, and that means so much to me because I've been asking for stuff and, you know, not everyone listens.
Clients are getting better, our patients are continuing to come back, they're continuing to reach out and tap into resources that they probably never knew existed. It's all indicators that we're doing something right.
The key is to understand the value of keeping patients out of the hospital, to demonstrate that these social determinants of health interventions actually save money.
I'm here for a purpose, and I'm here to fill in the gaps where the patient lacks.
It helps my communication with the patients. They open right up to me, and it's really brought a lot of joy back into my work.
I'm going to share another story, a hospital-based story. So this is St. Luke's Cornwall Hospital, and their chief executive officer integrated what matters to you into her leadership team meetings. So she, rather than saying, what are our barriers, what are our concerns, what do we have to address today, she'd open every leadership meeting and say, what matters to you? And I talked to her staff, I talked to her C-suite executives, and they said it felt different. You know, the meeting shifted towards solutioning rather than, you know, addressing problems. And it changed the dynamic, brought a lot of joy back into their work. And they've spread this across their hospital system. It's really in every ward, every unit, it's really quite impressive. So MHVC created a movement. You know, it started small with a couple of organizations and it spread, and now we have multiple organizations, some doing it differently than others, some doing it really embracing it, and some just, you know, sprinkling it in. The strategies, how do we do it? You know, word of mouth works really well with this. This is a real movement, and it's taken off internationally because it's kind of like see one, try one, experience it, and then tell your friend about it and try it again. That's kind of how this has spread really effectively. Some partners have really done a formal rollout where everybody got trained and, you know, have done it much more formally, but even that momentum that's building just by trying it and in one area and then it kind of spreads by word of mouth is very effective. And it has broad applications, as I mentioned, to patients, members, clients, families, and staff. So I'm going to take a moment to shift and have you have an opportunity to experience it. And in your folders, there's a What Matters to You Daisy diagram. And if you could just take a moment to fill it out. All right, you don't have to fill out every circle. Just a couple of things. What's important to you? What matters to you? If you were hospitalized or if you were calling for care, what is important in the way that you want to be treated? And let's take like 2 minutes. that video was produced by the Cleveland Clinic, and it's shown to everybody that works at the Cleveland Clinic in every position, from senior executive leadership to housekeeping and maintenance. Everybody sees that. What is empathy? Empathy is seeing with the eyes of another, listening with the ears of another, feeling with the heart of another. And I believe that asking what matters to you, listening to what matters to you, and doing what matters is an expression of empathy. That's what I've experienced, that's what I've seen, that's what I've heard back. So it's a way to actually teach empathy and bring empathy into our work. Asking, listening, and doing what matters in terms of from the employee stand, from the staff's perspective, gives meaning and purpose to work, because what I've heard is you're able to make a difference. You're able to do something that actually has an impact and empowers staff to do what matters. It respects autonomy and choice. I was able to make a difference. Although I couldn't fix the problem, I was able to listen, and the patient appreciated that. It brings something human back to the interaction. Her feet were cold. It was a little thing that made a big difference to her. It's something actionable that I could just do. I don't need to get permission. I could just take the initiative and do it. It improves patient joy in work. So joy in work is very hot right now, because if you have more joy in work, if you're asking staff to change, you're going to get a lot of pushback, right? If they're not feeling that they are respected in their work and have joy in work and are not burnt out, it's very hard to add more things to their job, right? So thinking about joy in work, because it improves patient experience, outcomes, and safety, and overall results in lower costs. Burnout's in the news right now. 54% of physicians are burnt out. One in 5 new nurses leave their first job within the first year, and 33% within 2 years. Nurse and physician turnover is costly for healthcare organizations. It costs about $1 million to recruit a physician, bring them on board. $1 million if you lose a physician. Nursing burnout is associated with higher rates of patient dissatisfaction, and provider turnover is associated with increase in the use of physical restraints, pressure, ulcers, infections, and patient falls. So directly relates to quality of care that's being delivered in the patient experience. And we know that if you address what is important to the people that you're working with, you could bring joy in work and you could decrease burnout. So the IHI, the Institute of Healthcare Improvement, has released an amazing framework about building resiliency and joy in work. And they have 4 steps for leaders in that framework. The first is asking your staff what matters to them. There it is again, right? And identifying those low-hanging fruit, the pebbles in the shoes that are easy to fix. I have to walk half a mile to get to the printer. Let's move the printer closer. Little things that make a huge difference. And then using improvements, committing to a systems approach, and then using improvement science to make those changes. This is an amazing document for improving joy in work. And in the framework, they talk about what the drivers that could have an impact on improving joy in work. And meaning and purpose, choice and autonomy, and camaraderie and teamwork. And what matters to you touches on all of those things. So by implementing what matters to you, you could actually have an impact on your staff's resilience. So we talked about asking, listening, and doing what matters. There's different ways that you could ask it. And here are just some ideas. You don't have to say what matters to you. Some people feel that feels weird. It's not the way I usually talk. What's important to you? Is there anything else you want to tell me about that I haven't asked about? For your care, what's your ideal scenario? There's different ways to ask the question. I'm going to share this picture from yesterday. So yesterday I went to an amazing event with 400 high school students from 46 high schools in Westchester to bring awareness of CODA, co-occurring disorders, so behavioral health and substance abuse in high school students. And we adapted the What Matters to You tool with co-designing it with high school students who said they didn't like the words what matters to you, so it's what's important to you. And they developed this tool to actually get to the heart of the things that are important to a high school student. You know, how that high school student is feeling at that moment, and using this tool to kind of guide the conversations with peers, with teachers, and just empowering themselves to speak about things. So this was really amazing yesterday. Okay, I'm gonna hurry up now. So the idea is, what do you do, you know, if you can't do what matters? Listen, be empathetic, attempt to connect with resources that may help, including, you know, outside resources, community-based resources. And the act of actually reflecting, you know, if you can't, you might not be able to fix it, you might not be able to do, but actually reflecting and using motivational interviewing skills to meet that patient where they're at, partnering with them, is doing. So you don't have to have all the answers, just talking and listening is doing. All right? How do you measure success? What we're doing at MHVC is we're collecting these stories of impact, and we have quite a few of them. You've heard some today. And we're actually looking at the stories to see if there are themes that can actually guide implementation of programming. For example, if pets come up all the time, right? The person gets agitated because they think they're going to be inpatient, outpatient procedure, and they have to stay overnight in the hospital. And why are they agitated? Because they don't have somebody to walk their dog. So if you ask about the dog up front, and you make that into part of your policy, you could the nurse can come in. I know you're probably worried about your dog. This is what we're going to do about your dog, because we think you need to stay overnight. So you could get rid of some of that angst by being proactive. So we're collecting stories. We're also looking at quantitative data, right? Like how many times are we asking, as well as, you know, outcome measures like HCAHPS, fall rates, number of patient member complaints, readmissions, ED discharges, ED readmissions. So different ways that you could actually look at the impact. Okay, and I wanted to share, this is from Cabrini. I said their numbers are pretty good on the HCAHPS to begin with, but you can see after what matters to you implementation went up to 100%. And it stayed that way. I just haven't updated the slide. Okay. June 6th is What Matters to You Day. It's the third or fourth year that they're doing this. Last year we went to our organizations with cakes and balloons, and we made a big deal, and we launched What Matters to You in multiple organizations on June 6th. The Institute of Healthcare Improvement is providing a lot of materials, and it's going to be a big launch across the country this year. So lots of materials coming your way and a lot of supportive things that could help you launch this. And I encourage you to celebrate with us. Okay. So today we talked about shifting healthcare from what's the matter to what matters to you by asking what matters, listening to what matters, and then doing what matters. We talked about dancing with your patients, because this is really a dance. You're partnering with them. It's not like you're telling them what to do, or you're really taking what you learn from them to design the care plan. To get to the heart of the matter much more quickly when you ask the question, and bring joy in work. Now here's my thing. What if at every clinician and staff member routinely asked what matters to you at every encounter with the people that they work with in their families? What would we learn? How would this understanding enhance our ability to develop genuine partnerships with the people that we're working with? If care was planned around what matters to each person, what would the impact be? Take a moment to think about that. These are a whole bunch of resources on the MHVC website. In your slides, you'll have the barcode so you can actually get to the website. We've compiled these resources from around the world, and we're continuing to add the videos that you saw today are on the website also.